There's just over a month left in the school year, which means many of your children are smack dab in the middle of testing season. And those tests, wow, they could bring high levels of stress. Chris is with Angela Lopez, a licensed therapist at the David Lawrence Center, who has some tips to help students cope.
Angela, we are in the middle of standardized testing season. The FSAs are, have been for the last couple of weeks, will continue in the next couple of weeks. And I think a lot of parents struggle with making sure that their children know that these tests are important, but also not wanting to put too much pressure on them. So what should these parents look for as far as signs of stress from their children?
Right. Well, signs of stress from children usually equate to signs of anxiety, which can occur as what we call somatic symptoms, which are symptoms that are physical in nature, such as stomach aches, nausea, headaches. Individuals kids who are also maybe feeling high stress will tend to also feel heart palpitations a little bit stronger than typical, shortness of breath. Symptoms like that.
Well, and I would imagine children aren't always upfront about how they're feeling, especially depending on their age. So how can a parent, if they notice those signs, how can they help the child cope with the stress?
Well, there are different things that a parent can do. One thing is if a child is feeling stress, many times it's because of their thought that perhaps they might fail, they may not do well. And so a parent staying positive is going to be one of the most important things that a parent can do. Meaning, demonstrate to your child, let them know that regardless of what the outcome is of the test, that you still love them, that you're very proud of them, that you're rewarding the outcomes, or you're not rewarding the outcomes as much as really rewarding the effort that the child is putting. Just staying positive.
And we know that in certain grades, you'll have an FSA and then you'll wait a few weeks and you'll have more testing. So what if these symptoms keep coming back and the parent keeps noticing these things or they get worse?
Yeah. So if these symptoms continue to occur or it starts interfering with everyday functioning and it's creating a lot of dysfunction in that individual's environment at school, and it's transferring to home as well, what would be recommended would probably to take that child in for maybe an evaluation or an assessment to see if there's some strategies, additional strategies that can be utilized in order to help reduce those symptoms.
Yeah, it's tough because so much is at stake with these students, especially if they're not doing well in school anyway with these tests. Well, Angela, thank you very much. Some good advice there. We want to let you know that Angela is a psychotherapist and the clinical supervisor of the David Lawrence Center's outpatient therapy services. If you'd like to get more information about the center and the services they offer, call the number on your screen or visit davidlawrencecenter.org.